Hello, my group and I will be discussing morbid obesity and surgical treatment. I'm Cassandra Lozano, and my other group members are Kimberly Maldonado, Raimundo Lugo, and Miriam Martinez, and we are Group 3. Morbid obesity is a well-known topic all over the world. However, in countries such as the United States, morbid obesity is a major problem. There should be more awareness of both calorie intake as well as the amount of physical activity that should lead to a healthy lifestyle. In this presentation, we will be discussing the etiology, statistics, signs and symptoms, treatment plans, as well as complications that may come with morbid obesity. Etiology. As mentioned in the past slide, obesity rates are uprising. However, what has caused the rise in obesity rates? It is factors such as the economic growth, industrialization, mechanized transport, urbanization, increasingly sedentary lifestyle, as well as unhealthy nutritional diets. Although there are all these factors that can cause a person to become obese, this is a disease that is highly preventable. It is just a matter of fact of taking it into your own hands and deciding to make better life choices. Statistics. Incidence and prevalence rates vary. By the year 2030, 38% of the population is estimated to be overweight. The other 20% is estimated to be obese. For the prevalence rates, this also varies depending on whether the person is an adult or a child. 55% of the American population is estimated to be adults, and the other 30% is estimated to be children. For mortality rates, the life expectancy of a person that is obese is expected to shorten by 4 to 7 years. As of the year 2000, 15% of the deaths were due to obesity. Some risk factors that cause obesity are factors such as environmental, socioeconomic, and genetic factors. Environmental and socioeconomic factors are modifiable. However, the factor of genetics is not modifiable. Although it is not modifiable, it accounts for less than 1.5% of a person's chance of becoming obese. This means that other factors can play a role in the person becoming obese, such as an unhealthy lifestyle.
Okay, signs of morbid obesity. An individual is considered morbidly obese if he or she is 100 pounds over his or her ideal weight and has a BMI of 40 or more, or 35 or more, or experiencing obesity-related health conditions such as high blood pressure or diabetes. Indications of severe obesity include high buildup of fat around the body, a BMI of 40 or above, signs of complications, which is hypertension. Symptoms of morbid obesity. The main symptom is excessive body fat, which increases the risk of serious health problems. Also common: overweight, binge eating, fatigue, potbelly, or snoring. Other symptoms are sweating, tiredness, joint and back pain, difficulty breathing, sleep problems including snoring, difficulty with physical activity, low confidence, and feelings of isolation. And of course, high blood pressure or other symptoms of metabolic syndrome.
Hi, my name is Miriam Martinez, and I will be presenting to you diagnosis and treatment for obesity. So, in order to diagnose obesity, morbid obesity in this case, we have to perform a few tests before to diagnose. Um, we have to perform a BMI, which is a body mass index, and also we have to run like for example blood tests like CBC, CMP, A1C in order to know if the patient is suffering from diabetes, which affect also the individual health. We have to weigh the patient, we have to measure the waist circumference, and we have to see if the patient is having medical history like hypertension, diabetes, or if for example, high cholesterol, and all those related problems. When it comes to treatment about obesity, this involves dietary changes. We can reduce the fried food and food with a lot of grease and increase fruits and vegetables. We can also increment the exercise levels a little at a time, starting anywhere from 5 minutes, then 10, then 15, and slowly increasing depending on the patient. With these types of patients, the increments have to be little by little because achieving small goals, because of the physical condition of this patient, is not be the best, and a great increment of physical activity can be contraindicated. Behavior changes can also be suggested. An example will be involving in these patients in different clubs where there are others like them that know what they are going through. Another treatment can be through medication. The doctor needs to see if the patient is qualified for this medication. The medications can have adverse effects or affect different patients depending on their health and other medications they might be using at the moment. These medications include orlistat, Ximia, Contrave, Sagenda, and Victoza, to name a few. One of the last options for treatment of obesity will be surgery. However, in order to perform these procedures, the patient has to be approved by the doctor because they have to have a BMI of greater than 30. To name a few surgeries, we can begin by naming the gastric bypass, where the surgeon creates a small pouch at the top of the stomach, and then the small intestine is cut a short distance below main stomach and connected to the new pouch. This bypasses most of the stomach, hence the name. Another surgery will be biliopancreatic diversion with the duodenal switch, the gastric sleeve, and the vagal nerve. These surgeries are quite effective to reduce the weight of the patient, but they have to continue taking care of their health by good choices of food.
Complications. Morbid obesity can diminish your quality of life and contribute to life-threatening conditions. Many people with morbid obesity can experience depression, anxiety, and low self-esteem. Other complications can include osteoarthritis, heart disease, stroke, digestive problems, type 2 diabetes, reproductive problems, sleep apnea, and certain cancers. Obesity is increasing, but we can take action by choosing a healthier diet and exercising regularly. Emotional support also contributes to a positive weight loss journey. In conclusion, a long term commitment to healthier choices is important to improving and maintaining your health.